When I left hospital, I contacted someone I knew who had been through the PINC program and was advised to go online to register, which I did. It was a really simple process. I sent off the application form and probably within 3 days I was funded for 5 sessions. I remember coming to my first session with a scarf on my head because I still had no hair, and knowing that it was only going to be me on my own, that was quite reassuring. So the first session was great. I felt really good. I got dressed normally and came in exercise gear, and it was actually my first appointment that we didn't look at blood tests. It was all about wellness. It wasn't to do with anything much about my leukemia except that what I'd been through, and it was looking at my recovery and where I could be in the next few months. The reassurance of the first appointment was having the neurology checked in my arm because of the Heckman line and the fact that I had blood clots and decreased movement. So that was reassuring to know that whatever exercise that I was going to do was not going to be damaging for longer term down the track. So once all of that was sort of sorted and Rachel sort of did all her assessments, then we came into the room and started the exercise program. It was great being able to take information home. I did get up and practice it in between my sessions. I always look forward to coming to my sessions because, once again, it was about wellness. Even if I guess one of the things you always worry about is feeling tired again, because does that mean that it's all coming back again? And I think as time has gone on, I've now continued with the Pilates part of the PINC program, and I attend Pilates every Tuesday night with Rachel, and I think, you know, I talk to people a lot about the benefits of actually doing something like that, because I think I'd never really been into Pilates. I've been into exercise for years but not Pilates, and never by a physiotherapist. And I think one of the other things I've said to people is, you know, the classes I go to now are nothing like I'd been to in the past. The small groups, the correction of your technique is just so important, and I think that's where the PINC program is. You know that you're safe, that you can't do any harm, and I think that's one of the really positive parts about it. I did start back at work, but only 4 hours twice a week, and still found that quite exhausting. But obviously with doing the PINC program, I was able to increase my tolerance to exercise and increase my energy levels. The need for programs and survivorship after something like cancer, and being, you know, having a life-threatening possible diagnosis. First of all, I think there needs to be a lot more education to nurses about the benefits of survivorship or PINC or STEEL programs. Nurses are in contact with patients, and not just patients but patients' families. There's usually one person somewhere that they may encounter that will have had cancer or had been diagnosed, and just giving out those messages that there are programs out there and the benefits of returning to the potential that you could be. And I think for a long time I sort of thought that my life I will never reach the potential that I wanted to do, and really thought that I would never work many days a week. And really, I've been quite surprised that I actually feel quite differently now, and I am able to work a lot more than what I thought I would. So I think sometimes actually giving people that opportunity, that life will be different, but you know, you might actually do different things that you never would have done beforehand either. Like a chronic condition, you get diagnosed, you get the treatment, you do the rehab, and you measure your quality of life. And I think that's where cancer rehab should be going, that you have your diagnosis, you have your treatment, and the next step of that is the rehab, and then you may go back into mainstream exercise from there. But I think it needs to be part of that whole pathway, if there was a clinical pathway for cancer patients.